Hi, I'm Dr. Dibyendu Banerjee, a senior consultant in the Department of Obstetrics and Gynecology at Bhagirathi Neotia Women and Child Care Center at Newtown. Together with me, we've got Dr. Bikramjit Das.
Hello, I'm Dr. Bikramjit. I'm the consultant neonatologist and the neonatal ICU in charge at Neotia Bhagirathi, Newtown.
Well, it happens that both of us have been here from the first day of this institution. This institution is ideally suited to cater to high-risk cases. And why do we discuss about high-risk cases these days? Because over the past decade or so, we've seen a huge rise in high-risk cases, mainly because of the older age of marriage, associated comorbidities, medical conditions like diabetes. We know that India is the diabetic capital of the world. You get a higher incidence of pregnancy-induced hypertension, other medical disorders. Plus, we are getting a lot of assisted reproductive technique babies, that is IVF babies, who fall or form a different domain. I, as a consultant gynecologist, when I get a high-risk case, I feel assured that we've got a very good neonatal unit headed by Dr. Bikramjit Das. And it is here that we monitor the patients at a regular level and take a decision when to terminate the baby. People talk about preterm deliveries. Preterm deliveries, yes, when we feel, as a gynecologist or as an obstetrician, when we feel that the baby is more secure outside the womb rather than staying inside the womb, we feel that that's the best time to take out the baby and we hand it over to our neonatologist. Bikramjit, your views?
Yes, sir, definitely. High risk cases have increased, as you said. And one thing I would like to add to this, that with these high risk cases, many times they are not predictable also. Many of the high risk cases are predictable, where you can kind of admit these patients, keep them for some time, you can plan their deliveries, but certain cases they are not admittable. So in those cases also it becomes important that the choice of center is very important. Now we have classic neonatal care centers, where the classic level 3 centers are the ones which are catering to babies less than 28 weeks and less than 1200 grams. It is very important that the delivery happens at the center, because many a times we see that we get babies from outside, but they are already compromised quite enough. So in those cases, the outcomes are not so very good. So that is important. And having said that, level 3 care, level 3 centers, we are different centers, because we as level 3 centers, we care for the baby from the time of birth itself, even ahead also. So it's the entire product on the entire care which we provide, which gives the good outcomes, right from delivery to the infection control, to good nutrition, to central lines management, infection prevention, blood banks, milk banks. So everything comes in the level 3 center, and that's what makes the outcome differences.
Yeah, as you said, that we need to have an in-house care in advance. Why? Because these extremely premature babies need corticosteroids. You need to give them antenatal corticosteroids, and when they are less than 28 weeks, we aim for neuroprotection. So we give them magnesium sulfate for 24 hours, and then we plan the delivery with a neonatologist to give better outcomes. So here it has to be an institutionalized care, and the care should shift from the obstetrician to the neonatologist and at that level.
Definitely. And it is a very important, it's not only the neonatal care, because even beyond the neonatal care. So as we are a multidisciplinary team, so the entire neurology is there, physiotherapy is there, speech therapy is there, hearing therapy, because these preterms, when they are going out of the NICU also, their story actually begins. Because then they have various complications like cerebral palsy, they can have speech delays, mental retardation. So all of that has to be monitored. And all of that has to be monitored under the same roof. So it becomes very easy for us, because we know the baby from day one, we know its complications, we know what are the possible risks, the entire team members know about the baby. So it becomes very easy for us.
Yeah, over the past few years that we've been attending to high-risk cases, now it's more or less become a referral center. We get patients from the districts who've got an extremely high blood pressure or an uncontrolled blood sugar or disease, maybe SLE. We get a lot of SLE patients these days, patients suffering from APLA. These are the patients who are more comfortable when they are admitted under the care of an obstetrician in a good setup, and knowing fully well that these patients may deliver at an earlier stage, they are in the hands of a good neonatologist in a level 3 neonatal
And I
care.
must add one point, sir, because as you practice so well, the time of delivery, which you were saying, it is very important, because that 1 week can cause a much difference. So we know that even a week can bring 10% improvement in survival. So pulling it from 26 weeks, mother coming with leaking, to 28 weeks gives us a huge advantage.
Yeah.
But to pull that, you also need that support.
Yeah,
which you-
and you need institutional care. Like you need to do the Dopplers to see how the blood flow is, the
Definitely.
baby is receiving, where there is a reversal of flow. When we decide that, yeah, it is, we've had enough, we need to deliver the baby. So that an institutionalized approach, a good teamwork of an obstetrician and a neonatologist. In many of my high risk cases, we discuss together that when should be the ideal time that we should go in to deliver the baby for a better outcome.
There are several other aspects also beyond preterm, like the congenital malformations. So level 3 centers are built to cater to these babies, because they will require multidisciplinary approach. For example, a lung malformation, a GI gastric malformation. So those are the cases where the surgeon has to be brought in immediately, where the CT scan has to be done, MRI has to be done. So that is also another important thing which we cater to in the level 3 center.
Yeah, not only that, like when you diagnose the case before that, maybe the baby has got a congenital diaphragmatic hernia. So this is a condition which needs treatment immediately after delivery. So if you've got a team of a good pediatric surgeon, you deliver the baby and then they take over.
Yeah.
Now we are seeing a lot of cases of CPAM. Those are there. There are urological abnormalities which are there. So if you have an institution which caters to neonates, like you've got a cardiac coverage, you've got a uro coverage, you've got a lung, thoracic coverage, and a gastric coverage. So in totality, a patient, when admitted under one roof, is catered to all the problems.
That's the brilliance of a level 3 center. Yeah.
So that is the message that both of us want to give out to all of you, that here in Newtown, we've got an institution which is par excellence, and it caters to all kinds of high-risk pregnancies, especially high-risk pregnancies, and you can be rest assured that you would be in the best of hands, in the best of care. Not only that, it's not only the doctors. We depend on our nursing staff.
Yeah, definitely.
Our
That's
nursing
one of
staff,
the strongest pillars.
That is one of the strongest points of this institution. We've got a very good backup system of registers and sisters.